Vancomycin-resistant Staphylococcus aureus, VRSA, was first identified in 2002. This was a significant discovery because vancomycin was commonly used as a last resort antibiotic to treat infections caused by methicillin-resistant Staphylococcus aureus, MRSA, which is resistant to many other antibiotics. The emergence of VRSA posed a serious concern for healthcare providers, as it suggested that options for treating this bacterium were becoming even more limited. The first cases were reported in the United States, and since then, health organizations have emphasized the importance of antibiotic stewardship and infection control practices to prevent the spread of such resistant strains. Vancomycin-resistant Staphylococcus aureus, VRSA, infections are transmitted through the same routes as other types of Staphylococcus aureus infections. The bacteria can be spread in the following ways. Direct contact with an infected wound or contaminated hands is the most common route of transmission. VRSA, like MRSA, can be spread by skin-to-skin contact. Individuals can contract VRSA by touching surfaces or objects that have been contaminated with the bacteria, such as doorknobs, linens, or medical equipment. Although less common, it is possible for VRSA to be transmitted through respiratory droplets if an infected person coughs or sneezes. Healthcare environments are common sites for the spread of VRSA, as the bacteria can be transferred indirectly from patient to patient via the hands of healthcare workers or through invasive devices like catheters or needles. Individuals can be colonized with VRSA, meaning they carry the bacteria on their skin or in their nose without signs of illness. However, if the bacteria enter the body through a cut, abrasion, or a medical procedure, it can cause an infection. Skin infections. These might present as boils, abscesses, cellulitis, and impetigo. Respiratory infections. Symptoms similar to pneumonia, such as cough, potentially with phlegm or pus, shortness of breath, chest pain during breathing or coughing, fever, and chills. Systemic symptoms. If the infection becomes systemic like bacteremia, it can cause fever, chills, low blood pressure, rapid heartbeat, malaise, fatigue, and confusion. Wound infections. Post-surgical or traumatic wounds might show increased redness, swelling, pain, delayed healing, pus or drainage, and warmth around the area. Infections in other body sites. VRSA can cause infections in the bloodstream, bones, osteomyelitis, heart valves, endocarditis, and joints, septic arthritis, with symptoms varying by the affected site. The treatment of vancomycin-resistant Staphylococcus aureus, VRSA, infection is challenging due to its resistance to vancomycin, which is often used as a last resort antibiotic for treating serious staphylococcal infections. When dealing with VRSA, healthcare providers must resort to alternative therapeutic strategies which may include the following. Alternative antibiotics. The use of other antibiotics to which VRSA is not resistant is the mainstay of treatment. Antibiotics that might be effective include daptomycin, linezolid, quinupristin, dalfapristin, tigecycline, and ceftaroline. The choice of antibiotic depends on the location and severity of the infection as well as the specific resistance pattern of the VRSA strain. Combination therapy. Sometimes, a combination of antibiotics is used to treat VRSA infections. This approach can help to ensure the bacteria are attacked in multiple ways, reducing the likelihood of resistance developing during treatment. Antibiotic susceptibility testing. Laboratory testing of the VRSA strain to determine which antibiotics it is sensitive to is crucial for guiding effective treatment. Source control. If the infection is associated with a device, such as a catheter or a prosthetic joint, removing or replacing the device can be an essential part of the treatment. Surgical intervention. In some cases, particularly with deep infections like abscesses or infections involving prosthetic devices, surgical intervention may be necessary to remove infected tissue or to drain abscesses. Supportive care. Supporting the patient's immune system with proper nutrition, hydration, and rest is essential. If the infection is severe and leads to conditions like sepsis, supportive care may also include intravenous fluids, oxygen, and medications to maintain blood pressure. Infection control measures. To prevent the spread of VRSA, hospitals and healthcare facilities must follow strict infection control procedures, including hand hygiene, use of personal protective equipment, and isolation of infected patients when necessary. Monitoring and follow-up. Regular monitoring of the patient's response to treatment is essential, and adjustments to the antibiotic regimen may be necessary based on clinical response and laboratory results. It's important to note that treatment should be tailored to the individual patient, and the choice of therapy should be based on the susceptibility profile of the bacteria, the site of infection, and the patient's clinical status. Given the complexity of VRSA infections, infectious disease specialists are often involved in the care of these patients.